Good morning, dear students. How are you? Always remember, students, that great things never come from comfort zones. You have to work hard for that. And what's your limitation? Your limitation, it's only your imagination. So let's start our lecture of pancreas. Today we are going to study about the pancreas. Now, just to introduce you with this gland, it is a soft, fleshy, elongated, exo as well as endocrine gland, and the shape is J shaped or retort shaped. Sometimes we use the word retort shaped. I hope you remember from your chemistry classes the spherical vessel with a long downward pointed neck. So pancreas is a gland that sits tucked behind the stomach in the upper abdomen, and it is located in, do you remember our quadrants? Epigastric and left hypochondric regions. What are the dimensions? The dimensions are about 15 to 20 centimeters in length, 2.5 to 3.8 centimeter is the width, and thickness is about 1.2 to 1.8 centimeter, and all these dimensions are difficult to remember, so you can have just a rough idea. You don't need to memorize these numbers. Now pancreas lies behind the peritoneum at the level of L1 to L2, and its weight is about 90 grams. Let's see this. Here comes the pancreas. You can see it's a J-shaped structure, and you can also see over here it's a soft structure, elongated gland. Let's see the quadrants. So the pancreas lies in the epigastric region as well as in the left hypochondriac region behind the stomach. Here lies the anteriorly, what do we have? The transverse colon. Transverse colon forms the anterior relation. It lies anteriorly to the pancreas. And since we just talked about that it has two functions, endocrine as well as exocrine. By exocrine means that there are acinous cells and they secrete digestive enzymes into the pancreatic duct. While endocrine means they are islets of Langerhans, they secrete hormones into the blood vessels. So it has a dual function, exocrine as well as endocrine. Here lies a C-shaped duodenum, and in the concavity of the duodenum we can see the pancreas, the head of the pancreas. So head fills the concavity of duodenum, and the body crosses the left kidney, tail reaches the hilum of the spleen, and it is related anteriorly to transverse colon. So here we can have a look at the transverse colon, which lies anterior to the pancreas, and if you see the tail of the pancreas, it is in relation with the spleen. Okay, let's study the parts of pancreas. The various parts are uncinate process, head, neck, body and tail. So there are 5 parts: uncinate process, head, neck, body and tail. Let's see, this is the uncinate process, the head, the neck, the body, and here is the tail. This is the pancreas. Let's see once again the uncinate process, the head, the neck, the body and the tail. The parts of the pancreas. Uncinate process we cannot see because anteriorly we have these vessels, and these are superior mesenteric vessels. Superior mesenteric vessels, they lie anterior to the uncinate process. This is the head, neck, body and tail. So we are going to study about these parts one by one. Let's study first uncinate process. Now, uncinate process, the relations of uncinate process are that it is related anteriorly to superior mesenteric vessels and posteriorly to aorta. So anteriorly we have superior mesenteric vessels and posteriorly we have aorta. Let's see the slide. This is the uncinate process. So anterior to the uncinate process are the superior mesenteric vessels, that is superior mesenteric artery and superior mesenteric vein. And posterior to this uncinate process is the large vessel, that is the aorta. Okay, easy. What about the head? Now head has 3 borders and 2 surfaces. 3 borders and 2 surfaces. The borders of the head are superior, inferior and right lateral border. Superior, inferior and right lateral border. The superior border, that is related to the superior pancreato-duodenal artery and first part of the duodenum. Superior border of the head of the pancreas is related to the superior pancreatico-duodenal artery and the first part of duodenum, while the inferior border is related to the inferior pancreatico-duodenal artery and third part of duodenum, while the right lateral border, that is related to the second part of the duodenum, terminal part of the bile duct and anastomosis between these 2 arteries. These 2 arteries are superior and inferior pancreatico-duodenal arteries. It's easy to remember, just see this diagram. So we talked about the borders, the superior border, the right lateral border and the inferior border. Now the superior border. Superior border is related to the superior pancreatico-duodenal artery, while the inferior border is related to the inferior pancreatico-duodenal artery. And the right lateral border, what do we have over there? The anastomosis between these 2 arteries, superior as well as inferior pancreatico-duodenal arteries. Easy to remember the relations, nothing to worry. Let's see one slide more regarding the relations of the head. Duodenum's first part is related with the superior border, third part with the inferior border and second part with the right lateral border. And arteries are superior pancreatico-duodenal artery, inferior pancreatico-duodenal artery, and here lies the anastomosis. They form the relations of the head of the pancreas. Okay. Regarding the surfaces, we studied about the borders, now surfaces. Anterior surface and the posterior surface. Anterior surface is the gastroduodenal artery, the transverse colon and the jejunum. And on the posterior surface is the inferior vena cava, renal veins right close to the diaphragm and the bile duct. So let's have a look. Now this slide is showing you the relations of the anterior part of the pancreas. You can see the pancreas over here just behind the stomach. So anterior relations are the transverse colon and the jejunum, and also one artery. I'll show you in the next slide. These form the anterior relations of the pancreas, surface of the head of the pancreas. Yes, you can see the gastroduodenal artery. So the gastroduodenal artery, the transverse colon and the jejunum, they form the anterior relations of the surface of the head of the pancreas. And posteriorly is the inferior vena cava, the bile duct, right across to the diaphragm, we cannot see over here. Also the kidney, the left kidney, and along with the kidney are the renal veins. So these are the structures which forms the posterior relations of the surface of the head of the pancreas. Now we come to neck. Neck is slightly constricted. Anteriorly, the anterior surface of the neck is PP. Posterior surface P means anterior surface is in relation with the peritoneum and the pylorus, while the posterior surface is in relation with the portal vein, the beginning of the portal vein. So we can see the neck which is slightly constricted. Neck is related with the peritoneum and pylorus, and posteriorly is the formation beginning of the portal vein. Now we come to body of the pancreas. Regarding the body of the pancreas, it is triangular in cross section. It is triangular in cross section. It has 3 borders and 3 surfaces. 3 borders, 3 surfaces. Anterior border, superior border, and the inferior border. The anterior border, that is related with the root of the transverse mesocolon. Transverse colon has attachment of the, and that is the mesocolon, and anterior border is in relation with the root of the transverse mesocolon. While the superior border, now superior border is related to the celiac trunk, and there are 2 structures, 2 arteries. Hepatic artery is present to the right, while splenic artery is present to the left. While the inferior border is related to the superior mesenteric vessels. We have already seen them in the earlier slides. There is one more term, that is tuber omental. It is nothing, it is an elevation over the superior border. Okay, let's see. First of all, that the surfaces and borders. Now the superior border, this is a triangular in cross section. The body is, if you take the cross section of that, it is triangular. It has a superior border, the inferior border, and the anterior border. And the surfaces are anterior surface, posterior surface, and the inferior surface. I'll show you the slide, it will be clear to you now. This is the pancreas. We are talking about the body of the pancreas. We have talked about the uncinate process and the head and neck. Now we are studying the body. The body has an interior border. It's triangular in cross section. It has an interior border, inferior border, and a superior border. 3 borders, right? And let's see the surfaces. The anterior surface, the inferior surface, and posteriorly would be, which is not visible from here, would be the posterior surface. 3 borders, 3 surfaces. Hope it's clear to you. Now we just talked about that with the anterior border is the attachment of the transverse mesocolon. So this is the transverse colon, and its mesocolon is attached to the anterior border of the body of the pancreas. Okay. Let's see now what we can see in this slide. Now we are going to say about the superior border. Superior border has 2 arteries in relation. On the right side is the hepatic artery, and on the left side is the splenic artery. Splenic artery and the hepatic artery. While the inferior border is in relation with the superior mesenteric vessels, that is superior mesenteric artery and superior mesenteric vein. Okay. Next, let's see The two vessels once again, mesenteric vessels, artery and vein, which are in relation with the inferior border of the body of the pancreas. Here comes the tuber omental. It is a slight projection on the superior border. Tuber omental. Now we have to study about the surfaces of body of pancreas. Three surfaces: anterior, posterior and inferior. Anterior surface is related with the stomach and the lesser sac. Lesser sac is attached to the stomach, which you must have studied earlier. So stomach and lesser sac, they form the anterior relations. Posterior relations are all the relations like aorta, left crus of the diaphragm, left suprarenal gland, left kidney and left renal vessels. They all form the posterior relations of the body of the pancreas. While inferior surface is related with the duodenojejunal flexure, jejunum and the left colic flexure. Regarding the tail of the pancreas, tail forms the end part of the pancreas. It is related with the gastric surface of spleen and it is related with the lienorenal ligament. Lienorenal ligament and with the splenic vessels. Let's see. So it is related with the tail is related with the lienorenal ligament and the splenic vessels, the splenic artery. So these are the relations of the pancreas. Regarding the arterial supply, pancreas is supplied by the pancreatic branches of splenic arteries, while the head gets additional arterial supply, that is by the superior pancreaticoduodenal artery, that is a branch of the gastroduodenal artery from the celiac trunk, while the inferior pancreaticoduodenal artery is from the superior mesenteric artery. So the arterial supply is by the superior and inferior pancreaticoduodenal arteries. You can see over here the superior SPD, superior pancreaticoduodenal artery from the gastroduodenal artery, the celiac trunk, while inferior is from the superior mesenteric artery. And at the right lateral border, they anastomose, anterior and superior and inferior. What else you can see? You can also see the splenic artery, and one of the artery gets large, and this is a large artery and the name is arteria pancreatica magna. Magna means big. That is from the splenic artery. What about the venous drainage? Into the splenic vein, superior mesenteric vein and the portal vein. Splenic vein, superior mesenteric vein and the portal vein. So the splenic vein, you can see the venous drainage is into the splenic vein, portal vein and the superior mesenteric vein. So they are responsible for the venous drainage. Regarding the lymphatic drainage, pancreatico-splenic lymph nodes, celiac lymph nodes and superior mesenteric group of lymph nodes. These are lymph nodes which are scattered over the respective areas, like pancreatico-splenic lymph nodes. Spleen and the pancreas are the pancreatico-splenic lymph nodes. Here are the celiac lymph nodes. You can also see the superior mesenteric lymph nodes. The lymph nodes you can see over here, they are scattered and they are responsible for the lymphatic drainage. Nerve supply is parasympathetic and sympathetic. Parasympathetic is by the vagus, that is responsible for secretions, and also there is one hormone that is known as cholecystokinin that is also responsible for the secretions. While sympathetic is vasomotor and they form plexuses around the arteries. Now the important part of the pancreas is its duct system. The first is pancreatic duct of Wirsung. This is the main pancreatic duct. Main pancreatic duct, and it lies near the posterior surface of the pancreas, and it is recognized by its white color. It's white in color, and the lumen is about 3 mm. 3 mm. Now it receives many tributaries, many small ducts which join at right angles to its long axis, and it forms a pattern that is known as herringbone pattern. Herringbone pattern. Let's see. You can see over here. This is the main pancreatic duct. Main. And here is also one accessory pancreatic duct. And they open where? Into the duodenum. Can you see the sphincter? That is the hepatopancreatic sphincter. And they open the duodenum, and this area where they open, that projection is known as the major duodenal papilla. Major duodenal papilla. While the accessory pancreatic duct also opens into the duodenum, and that opening is minor duodenal papilla. Minor, major pancreatic papilla. Now, what is this hepatopancreatic ampulla of Vater? What happens? The bile duct and the pancreatic duct, they join to open into the second part of duodenum. So we have just seen that major duodenal papilla, that is the opening of the pancreatic duct into the duodenum. It is the opening of the pancreatic duct into the duodenum, and it is situated in the second part of the duodenum, about 7 to 10 centimeters from the pylorus, or at the level of the second or third lumbar vertebrae. So this is the hepatopancreatic ampulla of Vater. You can see over here. So you can see over here the pancreatic duct. Within the head of the pancreas, this pancreatic duct is related to the bile duct. Bile duct, which lies on its right side, and these two ducts enter the wall of the second part of the duodenum, and they join to form the hepatopancreatic ampulla of Vater. And the opening is major duodenal papilla. While the accessory pancreatic duct of Santorini, that begins at the lower part of the head, and it opens at the minor duodenal papilla. Okay, major and minor. So we can see here once again the main pancreatic duct, okay, that is joined by the bile duct, and they open into the duodenum, and that is a hepatopancreatic ampulla of Vater. And here comes the accessory pancreatic duct. It opens, and here it forms the minor duodenal papilla. That is the minor is duct of Santorini. It is accessory pancreatic duct. It is not universally identified also. It lies cranial and ventral to the main duct and joins duodenum at the minor papilla. We have just discussed all this. So one more slide, minor and major papilla. This is important. You can get a short note on the pancreatic system of duct. So I think it is clear by now. The diagrams also you can draw. Now finally we come to the pancreatic disorders, that is the applied aspect of the pancreas. There can be inflammation of the pancreas. It can be acute or chronic, and usually it is secondary to some biliary tract disease, while other causes are like alcoholism, surgery of biliary tract or stomach. They can also result in pancreatitis, that is inflammation of the pancreas. So this is the healthy pancreas, and here is the inflamed pancreas. So you can also see over here, there is inflammation of the pancreas. What happens? Sometimes gallstones, they lodge in the duct and they block the lumen, and they can cause the inflammation of the pancreas. The gallstones, these are the gallstones which can be present in the duct. Also, we have the chronic pancreatitis. In this chronic pancreatitis, what happens? The organ becomes small, atrophic, and the patient's ability to digest food and to make pancreatic hormones is lost, and the most common cause is alcoholism. So you can see the atrophied pancreas, and you can also see the dilated pancreatic duct. Here are the stones in the duct. Yes, it can result in dilatation of the pancreatic duct. It can be seen both in the acute as well as chronic pancreatitis, and sometimes neoplasm. In fact, neoplasm is a common cause which are associated with the dilatation of the pancreatic duct, or there can be some problems which are related to the biliary tract. See, this is the dilated pancreatic duct, and here are the calcifications or the stone formation. So it can result in the blockage and dilatation of the duct, pancreatic duct. Yes, there can be hemorrhagic pancreatitis, that is characterized by bleeding within or around the pancreas, and is usually considered a late sequela of acute pancreatitis. It's not a good condition. They can be, you can see over here, there is hemorrhage over the pancreas, and necrosis also is there. Hemorrhagic pancreatitis. Now we cannot ignore the pancreatic carcinomas. See, pancreatic carcinoma cancer, it has a tendency to spread silently before the diagnosis is made. So it is one of the most deadly cancer because we are not able to diagnose it. It is a silent cancer. So types can be exocrine or endocrine. Exocrine pancreatic cancer and endocrine pancreatic cancer. So the cancerous growth can be seen over here, and the patient presents with jaundice, the yellowness of the eyes. So these are the symptoms the patient may present with. So these are the carcinomas, pancreatic cancer. Finally is the pancreatic tumors. What happens? The most common malignant tumor, they arise as adenocarcinomas, and if there is a tumor in the head of the pancreas, the patient presents with painless jaundice and anorexia. Anorexia means the patient doesn't feel hungry, loss of hunger. And there is one sign that is known as Thomas sign, that is the production of silver stools, that is indicative of cancer of the ampulla of Vater. So you can see the whole this pancreas can result in carcinoma. And I think this is the pancreatic tumor. Just have a look. And yes, thank you so much for your attention. Have a nice day. Bye bye.